Hello everyone, so welcome back. In this video we are going to learn about medication adherence. So generally a medication adherence is nothing but the patient's behavior coinciding with the intention of the health advice when a health advisor or a health provider gives. So it's one of the most important factor which will determine the therapeutic outcome, especially for those patients who are having a chronic illness. So there are three specific terms which define the medication adherence, and these three are very important for the patient's health, how they are using the medications, and for a better outcome. So then those three terms are adherence, compliance, and persistence. So, whereas adherence can be defined as the patient's conformance with the provider, it means that how the patient is adhering or conforming with the doctor's recommendation. Or you can say it's a filling of the prescription as well as getting it refilled. Whereas the compliance is nothing but the following on the patient's follows the instructions of the healthcare provider. It means that when and how to take the medications, how the patient is taking means when he is taking and how he is taking. Next is the persistence. So persistence can be defined as the continuous taking procedure, how well the patient continuous takes their medication regimen. So persistence is nothing but continuously taking, compliance is following, and adherence is the conformance with the provider. So it may look like taking medication is a very easy task, but no. Non-adherence is very common, especially in India. It is very common, and non-adherence lead to many serious consequences. And and even taking less prescribed medication, it leads to under taking or overtaking. The techniques which we are using for taking medications, or the factors or taking at different times, all these are the things lead to the medication non-adherence. And when a patient chooses not to take the medication properly, it means that he may be taking in increased amount, or he may be taking in less amount. Thus it will lead to underdosing and overdosing, and which lead to the chances of admission into the hospital, and eventually it will affect his life also, and even the death can occur. So, according to WHO, medication adherence is to a long-term therapies can be defined as the extent to which a person's behavior taking medication, following a diet, or executing a lifestyle changes. It corresponds with agreed recommendations from the healthcare provider. It means that treatment, if adherence is there, then a good outcome will come. If adherence is not there, then it will lead to other serious consequences. Next is the importance of medication adherence. These are the situations where the adherence is very important for a good outcome. So example, first one is replacement therapy. So in this thyroxine and insulin, I have taken example. So for these situations, like when a patient is suffering from hypothyroidism and even in diabetes, if they don't take this medication on time, it will lead to serious consequences. That's why it is recommended to use it regularly. Next is maintenance of pharmacological effect. So in this antihypertensive and oral hypoglycemic agents I have taken, these agents will control the blood pressure as well as maintain the blood sugar levels respectively. So it is very important to take these medication on time to maintain a pharmacological effect. Next is maintenance of serum drug concentrations. So in this also, to control a particular serum drug concentrations, example for this anticonvulsant are taken. So subtherapeutic levels of these agents will increase the risk of convulsions in an epileptic patient. Next is these are the public health importance diseases. Some diseases which affect the public health, like the tuberculosis, HIV, and opportunistic reactions. All these are the diseases where non-adherence plays a very major obstacle for achieving the goal or to get a good therapeutic outcome. And other chronic diseases such as the diabetes and hypertension, here also an adherence is very important. If adherence is not there, then it will lead to short term and long term complications. These are the causes of medication adherence. These are the 5 dimensions of adherence which are given by the WHO. The first one is social and economic. In that, it will come limited language proficiency, low health literacy, unstable living conditions, lack of health insurance, or medication cost. These are the factors which will contribute to the medication non-adherence. Next is healthcare system. So in healthcare system, even the patient provider relationship is very important. Then long wait times also lead to non-adherence, lack of care continuity, and restricted formularies. These are the things, or these are the situations due to which medication non-adherence occurs. Third one is condition related dimensions. In that, lack of symptoms or the severity of symptoms, then depression and psychotic disorders may lead to the non-adherence. Then complexity of the medication regimen, therapy in duration, frequency of changes, actual or perceived side effects. Then these are related to therapy. Next is the patient related factors. It may include the visual, hearing, cognitive impairments, knowledge about the disease, the perceived risk or the susceptibility to disease, perceived benefit of treatment, motivation, and confidence. And these are the things which will lead to medication non-adherence. Pharmacist's role in the medication adherence. Here it plays, the pharmacist, he or she plays a very important role for improving the medication adherence. They can actually show the medication to the patient and give information on the medication. They can even provide the verbal and the written information to patient. They can give the other knowledge also to the patient, which can include the name and purpose of the drug, when and how to take medication, then the side effects, then drug interactions with food or with the other drugs, then the duration of therapy. Even if they will give knowledge on the actions to do when a dose is missed, and they will tell how the medication is working. And if they are not, if the medication is not working, they can even tell and give those information also. And a pharmacist which contribute towards improving medication adherence, they by advising the prescribers about the simplification of drug regimens, then they can give the knowledge to the patients on various things, and even they can assess the patient's knowledge also. And by taking patient's interview, and they even can assess the patient's ability to understand and recall information in case of any adverse drug reaction. These are the strategies through which a pharmacist patient relationship can be improved. And at the end of the process, the pharmacist will be able to determine the patient's own assessment, means own assessment of the adherence to the medication, like and the counseling of any specific medications, and the preparation of individualized medication information sheets. Next is the monitoring of patient medication adherence. Actually, there are so many approaches which are used or which are aimed for monitoring medication adherence, but none of them have shown a good result. So in that, these are the few methods which we are going to learn about medication adherence. So in the monitoring of the medication adherence, there are of two types, the direct method and the indirect method. So in the direct method, we will be doing it by the measuring blood or urine levels of the drugs and then measuring the blood levels of the markers. And in the indirect method, objective pill count, prescription refill, and others are there. So in measuring the blood or urine levels of drug, it indicates the short-term adherence. And then in the blood levels of the marker, they will add the marker to the medicines and measures the levels in the body. Example for this is the low dose phenobarbital. It gives both quantitative and qualitative data over the preceding few weeks. Next is the indirect method. Indirect method, in that the first one is the objective pill count. In this method, we will be counting the tablets or the pills remaining in the container, and this method is indirect method, and it is not accurate to that much of level. Next is the prescription refill. Accurate data monitoring systems will be there, through which we will be getting idea about how many times the patient has refilled his prescription. Next is the electronic medication containers. In this, while opening and closing time, they will that while opening and closing the container, it will record the time. So due to this opening and closing time, we will get to know medication adherence is there or not. Next is the health outcome measures, and that's assessing the therapeutic efficacy. Like in these diseases, like or disorders, the PP control or the asthma severity or survival, any other hospitalization due to the therapeutic efficacy. Through that therapeutic efficacy, we will be able to identify the medication adherence. Next is clinical attendance. In that, then we will counsel the patients, and through this and clinic not attenders. And it means that those patients who are not visiting the clinic on their proper times. Through this, we can get to know about the medication adherence, even the appointment timings, then these preventive visits, and even in the indirect method also, it will be including the patient interview and the diary making. Through this, we can get to know the medication adherence. So this was the medication adherence topic.